Go. When performing an AP hip, in this case it would be a right hip, the central ray would be placed approximately at the femoral neck. How do you locate the femoral neck? You need to draw a line from the ASIS to the pubic symphysis. In this case, I'm going to use a piece of lead to represent those two spots, where you would draw a line between those 2 points and bisect that line, which would be, bisecting means in the middle of that line. From there, you would come down 1.5 inches to the femoral head, 2 inches to the femoral neck, and that's where we're centered right now. If I leave my lead shield here, the patient is already shielded, and no further shielding for a female needs to be done. If it was for a male, I would need my shielding down like this. That's for another lecture. Anyway, notice where the central ray is. It's at the femoral neck. I need to make sure that my marker is placed so that it's not in the way of the femoral, the greater trochanter of the femur. My collimation is already collimated to 8 inches wide by 10 inches long. A very safe place to place your marker is in the upper right hand corner. Now, in this case, you can see that the femur is at an angle going across the IR like this. So there's certainly plenty of room to place your marker in the lower right hand corner. Remember, before you take this exposure, you need to have the patient rotate their femur internally so that the greater trochanter is now seen in profile. This is to show you that the appropriate collimation will include all anatomy of interest, and there's clearly plenty of room to place your marker. Again, you can either place it down here or up here. But since this is the right hip, it must be a right marker. Okay, done.